You are listening to Hit Play, Not Pause, a Feisty Menopause podcast for active, performance-minded women. I am your host, Celine Yeager. Each week, I bring you advice from athletes, scientists, researchers, and other experts to help you feel and perform your best, no matter what your hormones are doing. This show is a production of Live Feisty Media. Hey, strong, feisty women. So, if you've ever felt stiff and stuck, a bit like the Tin Man of The Wizard of Oz after being left out in the rain, or have had tight, sore knots that restrict your mobility, or have battled issues like frozen shoulder, this show is for you. We talk a lot about mobility here on Hit Play Not Pause because as estrogen walks out the door, our musculoskeletal system can really take a hit, becoming weaker, more inflamed, prone to injury. But what's often left out of this conversation is our fascia, that thin casing of connective tissue that surrounds and holds every organ, blood vessel, bone, nerve fiber, and muscle in your body in place. Scientists used to think this stuff was just inert. Medical students would literally toss it in the trash. But now we know it's way more than just structural webbing. The fascia has nerves that make it almost as sensitive as your skin. And when you're stressed, it tightens up. Fascia also gets drier and tighter and stickier over time and with menopause, which can limit your mobility and lead to painful knots and poor movement patterns that open the door for pain and injury. So this week, sit back because I have a mini masterclass, if you will, on mobility and myofascial, and that's the fascia that surrounds the muscle, health and training. Our instructor for this one is Nicole Armbrust, who is a performance physical therapist with 24 years of experience, a master's runner and certified running coach with 17 Boston Marathon finishes under her belt, and a graduate of the Fellowship in Applied Functional Science program through the Gray Institute. And she is all about the fascia. We had Nicole come in and give this presentation to our Level Up membership. And when she was done, I was like, more people need to hear this. So I had her come in and give it podcast style. So this one is a little different. Nicole is talking through her slides, which you don't see, obviously, if you are just listening to this, but we describe the slides as we go. And if you want to check out those slides, you can always go to our YouTube channel. We put all of these shows on our Feisty Menopause YouTube channel, and you can watch the whole thing or go and just check out the slides you want to see. I'll put a link to that in the show notes to make it super easy to find. Nicole has also been generous enough to provide us with free resources, including her quick and easy mobility and fascial massage and stretching workouts. So I'll put a link to that in the show notes too. It is a great resource complete with YouTube links so you can follow along to all of her moves. So this one is a little different this week, but I really do hope you enjoy it as much as I did. It's also a little on the longer side, so I'm going to keep this intro short. I do want to just announce before we go one super exciting thing. We have partnered with the incredible folks at Thompson Bike Tours to create a Feisty Girona, yes, that's Girona, Spain, gravel camp. It's going to be 7 days and 6 nights in Girona, Spain, which is a mecca for gravel cycling. And to be very clear, the gravel roads there are pretty much champagne gravel. So this is not designed to be chunky and difficult and, the kind of sort of Kansas style gravel that some people may think when they think of gravel cycling. This is, if you are a road cyclist, you will be comfortable. You just need fatter tires. We can talk about that. Anyway, it is designed to be beautiful and fun and immersive in an amazingly gorgeous place. And the theme of our week is midlife reset. We have heard from women who just want some time to figure out what they really want in this next stage of life. So we are also going to be spending time connecting and talking and just sharing our thoughts and our visions so you can prepare to come back refreshed and focused and with a bunch of new friends. So I will drop a link for that in the show notes too, but suffice it to say, I'm super stoked. All right, enough of me. Let's have a few words about our awesome sponsors and get on with the show. All right, Nicole, welcome back. I'll just be transparent and say that we've had a few conversations to to get the show that we wanted. And um, you came into our Level Up membership and you gave this really wonderful presentation on mobility and fascial work. And you do a lot of work as a runner yourself, and this is for all like female athletes, especially in this space. And after you were doing it, and there were so many questions, I thought, this is the show. Like this is the show we really need to be talking about. Um, because there are so many issues with injuries and all of that that come up. And I think that most people just don't, we hear mobility and we think all different kinds of things. We think stretching, we think this, and most people don't understand fascia and how all that works. So let's just go over this presentation and really share your knowledge on this topic with our audience, because I think it's going to help a lot of people maybe not get injured.
Yeah. Well, first of all, thank you so much, Celine. And selfishly, I've enjoyed the opportunity to chat with you multiple times. Just now that we got the finished product here, and I'm super excited to share this information with your group, this amazing group of athletic women and these masters athletes. It's super exciting just because I mean, selfishly, it started for myself. Like, what do I need to do to keep going here? And then
Mm.
I, just kind of went into this rabbit hole and found this really exciting thing that, I mean, we don't have the fountain of youth yet, but maybe this could be the next closest thing.
Excellent. Well, let's get right into it. I mean, we're going to talk about mobility and fascia work. And, in my intro, I've already described that you have Jumpstart Running, you're a physical therapist and a master's running specialist. So, movement coach. So let's just go into the presentation and we'll talk you through it. This will be on YouTube, so you can check it out there, but we'll also talk it through just in case you are listening only on your walk, run, or ride.
There we go. All right, we'll take it from here. Thank you so much. So, as Celine said, my name's Nicole. I've been a PT for 24 years and a marathon runner for just as long. But what I really have gotten into the last couple of years is specializing in working with female masters runner because I started listening to this incredible podcast and realized let's do it. Let's serve these women. And I also describe myself as a movement coach, meaning that I help athletic women basically relearn how to move their bodies. And we're going to get into that today. And this is a perfect segue. So, because I've seen these women and mobility is a big piece, and mobility's, it's kind of like talking about glute strengthening. It's out there, we've heard
Mhm.
about it. So what's the big deal about it? Why is it so important? And so, what I want to talk about first is what it is and what it's not. So,
Okay.
there's words that are often used interchangeably and in conjunction with mobility. And the first one is flexibility. And we say, well, are we talking about stretching? Uh, there's some history with that. And, you can again go into a giant rabbit hole of research and say, well, what about static stretching? And I'll tell you what, you tell a runner, you mentioned stretching to a runner, you're going to get an eye roll, right? Because a lot of the traditional stretching that's out there has been passive and it's really just been working on one muscle group at a time. So when it comes to flexibility and stretching, that's kind of the old model of talking about it. And so when we talk about mobility, we've got this nice picture in the middle of this. I think it's a cat putting its paws on a can of WD-40. And so when, because we don't have the ability to find WD-40 and put it in the body yet, mobility is a great place to start. And meaning that we've got active movement that is going through full range of motion through the joints. And it's not only full range of motion, it's in three-dimensional motion. And we're going to talk about that a little bit more in a second. And the third word that gets used interchangeably is stability. And what we're talking about with stability is being able to control this motion that we
Mhm.
have, the mobility. A good example is, standing up on one foot. And can you control the motion and the balance in your foot? And so that's being able to control that. And if you think about, of course, I'm going to go back to running. When the foot hits the ground, do we have the ability to control how the foot lands? So I had alluded to the fact of talking about 3D mobility. Now,
And
when I,
that's very important, not to
oh
step
yeah,
on you there, but that's very important for injury prevention, right? We all think about mobility and flexibility, but stability is The yin to the yang. I always think of it. Yeah.
Ooh, I like that. The yin to the, and it's so true. And actually, I'm about to mention my mentor, Dr. Gary Gray. He has he calls it most stability, like
Oh,
combining
okay.
the yin and the yang together.
Yeah.
So
Okay, great.
yeah, so that essentially you can't have one without the other, or you
Yep.
can, but that's can be problematic. So um, I mentioned Dr. Gary Gray, and when I had gone to PT school, I finished PT school, and we were taught things traditionally most of the time, working with a patient on a table.
Yeah.
And for those of us that are athletic women, that unless we pass out from our exercises after or our activities after, we're not typically lying down unless we're resting, right? So the traditional clinical pathway didn't make a whole lot of sense for me, and that's when I stumbled upon Dr. Gary Gray, and he's known as what's called the father of function. And it was when I went and did a fellowship program with him after grad school, I always said my professional world turned from black and white to color. And that's because he was the first person to talk about, no, you don't want to get your patient, client, or athlete on the table. You want to find out what it is they want to get back to doing, and that's how you're going to train them. And so I just thought that was incredible. And then he went on to talk about the fact that our body just, on a table, you can picture in a traditional PT setting somebody doing a leg lift, right? And with a robot leg up and down, but our body doesn't move that way. If you think about all the sports, it's pretty atypical. And so he really just talked about the fact that our bodies move in three planes of motion, meaning the sagittal, which is forward and backward, frontal, which is side to side, and what we call the transverse plane, which is rotation. And there's a picture of a woman doing some weightlifting here, which is a primarily sagittal plane activity. And that's not a bad thing necessarily. It's just pointing out that with this type of movement, it is primarily in one plane of motion. There's a statistic that says up to 70% of recreational runners will experience an injury in a year. And part of that is because running is, it's a linear activity, but repetitive activity over and over and over again as well. And what a lot of people don't realize is that the running is in a single plane, but you have to train the body in three different planes. And we'll talk about training aspects and why. So we're going to talk first about, why does mobility matter? Why should we pay attention to it? Besides, it's in a lot of the magazines. And there's a picture here. I love this picture because it's a woman pulling the bow and arrow. Makes me think about when Gina Davis was in the Olympics, right? For archery. And so if you think about this example in terms of pulling back a bow and, loading a bow to shoot an arrow, the more range of motion you get back, the more you can pull that back, the more power you're going to get back in the activity. So another saying from Dr. Gary Gray at the Gray Institute is, you load to explode. So if we don't spend the time cleaning, I always say to my clients, we got to clean out the cobwebs. And so that's in our joints, meaning if we don't spend the time to excavate, and, it's kind of like that phrase, we're leaving money on the table. We don't want to leave any motion on the table, because that's just, it's, free strength and power when we go to use the muscles. So now there are certain instances where there's arthritis and anatomic limitations, but that's why you go see your friendly PT and movement specialist, and they can help you with that. All right. So that's why we want to make sure that we clean out the cobwebs. It's kind of like preparing, if you go to paint, why you want to prime think of the mobility as priming the body. And so that's where we get the range of motion all set up. And now we move on to phase two. And this is the part where it's super exciting. And I get really stoked to share this information. So we say, well, okay, what is the big deal about fascia? So now we're talking phase two. We had mobility first, and now we're going to talk about fascia. And so first of all, for some people say, well, what is it? I don't, most people are getting familiar with the word. And so well, what does that mean? And so if you think about it, if you go to the store and you get a package of chicken and you open it up and you clean it off, there's those stringy pieces on there that you want to cut off. That's kind of what we're talking about when it comes to fascia. Now, like I said, I had graduated from physical therapy school in dating myself here, which is fine. I'm 15, proud of it. when we had gone through PT school, we had to go through the cadaver lab, and we were told to throw all of that stuff away, meaning the
It's
fascia.
amazing.
That you don't pay attention to it. Yes, that's what it was, and that's why it's also referred to as the forgotten organ. And
Can
it
you
is,
imagine? Like it's part of your body that's covering your
yeah,
muscles.
yeah. We'll just throw it in the bucket. Yeah,
It's not useful. It's fine.
yeah. Well, it's one of those things we look back and say, well, we used to think that cigarettes was a good thing to advertise too. Like, oops, we learn. We hope we
We
learn.
learn. Yes.
All right. So now we realize, oops, okay, we made that mistake. And so I like to refer to the when we talk about, okay, so it's basically a connective tissue, but what does it do? And I like to describe it as three S's of fascial function. It basically is a spring in your step. It gives us structure from head to toe, and it provides support to the muscles, tendons, ligaments, tissues, organs, nerves, joints, and bones. Woo, it's a mouthful. And that's basically a big slide that says it's really important. So we've come a long way from throwing it away to realizing, okay, this seems like an important thing. So something really interesting that I did not know previously about the fascial system is that there are 6 to 10 times more proprioceptors, or basically nerve pain receptors, than that are inside the muscle. Now, this is really, really key because we think, if you sprint, you say, "Oh, my muscles are sore." But in reality, what we're finding is that it's probably more or less because we have more sensitivity in this fascial system. It's more the fascia that gets sore and stiff and things like that, as opposed to the muscle. So this is going to be really important. Like I said, it's the largest sensory organ in the body, and that's because we have so many more receptors and free nerve endings in there. They again, because the research, kind of like now that we're doing more research into women's medicine, they're now doing more research into the fascial system, and they just discovered even just something called the fasciocite just even a couple years ago. So it is ongoing and it's super exciting. Well, I think it's super exciting, but I'm a big nerd, so it's super exciting it should be super exciting for masters athletes as well. Um, as far as the composition, this is interesting as well because it is a 70-30 combination, 70%, 30% combination, where 70% is actually a gelatinous material. And this is a big mouthful. This word is called hyaluronic acid. And that is a really, really, I think I read somewhere in one of my in one of my sources, it's called uh, biological gel,
Mm.
basically. So, and if you want to think of it that way, and so a lot of gelatinous, and that's important for lubrication. That's what the hyaluronic acid. That's also a substance that if you've had to get knee injections and things like that, but we won't spend too much time on that, but it's a big important piece of the puzzle. So then there's only 30% of the fascia that's solid, which is mostly comprised of collagen. Now, most people have heard of collagen. It's very popular, and we'll talk about that more. But it's super interesting to know that this is most, and especially for masters athletes, that this is more liquid than solid. So and there's 3 layers of this tissue. So there's what we call a superficial layer, that's the one that has the most lubrication, which is refer to that as slide and glide. So that's above the muscle. So those, if you put your hand on your forearm and moved it back and forth, that's your superficial fascial layer. Second layer is the deep tissues, and that's really important as it surrounds the muscle. And we'll talk more about that. And then there's a third component, which is visceral, and that goes around the organs. So it's important to note that if you can think about, superficial, deep, and visceral, they're all different types of layers that are wound basically from head to toe. So the next slide says here, the system is not separated. And this is really important because we want to make sure that, traditional training, when we think of training, historically, we think I'm gonna make my muscles strong, right? I'm gonna strengthen my muscles. But what we want to talk about here is that it's not just muscles that we're working on. There's three systems that are involved when we're talking about the fascia, and that is the nervous system. We talked about how highly innervated it is. We're talking about the muscular system because it's all wound around that as well. And then we're also talking about when we say the fascial system, there's a picture here of a spider web that has little droplets on it. So instead of musculoskeletal, where we think just bone and joint, we want to think about the neuromyofascial system. And that's going to be important for our training aspects as well, which we'll get to. Now, there's a concept called structural integration, and that's from a scientist in the past, Ida Rolf. And you may have heard of Rolfing techniques. And this is where we came up, first started to say, well, wait a minute, the body doesn't function as just a quadricep. The body doesn't function as just a bicep. So if we're going to be working on these muscles, we want to look at the body as a whole and as an integrated unit. And that's where this next gentleman, there's a picture of a book called Anatomy Trains, and that's by Dr. Thomas Myers, who has been studying the fascia, I think he said since 1974. So that's around 50 years he's been spending on the fascial system. And it's because of Thomas Myers, I have this little structure here called the tensegrity, or what they refer to as biotensegrity. And what this means, it's an architecture description, but that again, like I said, we're not just bones and muscles, it's a whole system. And the reason for when we talk about structural integration, it's really important to think of the body this way, that yes, if you have a problem in your quadricep, that might be where the pain is. But if we think about, okay, well, everything is connected, it could be a problem because you have a restriction in your shoulder. And so we'll talk about that a little bit more. But when it comes to Thomas Myers, what's really interesting about the work that he's done with all of his cadaver, he was not throwing the tissues away when he was in the cadaver lab. And as a matter of fact, what he found is he discovered these, what he refers to, says anatomy trains, or their fascial lines, meaning that he's not just looking at the leg. He noticed that it goes from the base of the foot all the way to the top of the skull. And he found these lines in, I believe we're at 12 of them now. So superficial lines, lateral lines, spiral lines of all this structural fascia throughout the body. He said, well, wait a second. This is going to be really, really important as far as how we work with patients, clients, and athletes. And so Thomas Myers is really got some really interesting stuff out there about the fascial system. Now, when we talk about the property, so what is this stuff and what is it made up of? I told you about the percentage of the contents, but there's 4 different properties when it comes to fascia. And this is really important because it's going to fall into our training methodology as well. So we talk about 4 different properties, and the first one is viscosity. And so meaning how thick, what's the purpose of viscosity for our thinking of ourselves as athletes? It's basically helping us to absorb, in the case of a runner, absorb landing, right? Or in the case of somebody who's doing, bike racing, how much, if you're up in the air, airborne, is that fascial system going to help you absorb with the impact? And that's where viscosity is important. Next property of the fascial system is elasticity. Now, this one is super important because if you think about, I want to give you an example with a tendon. If you think about the Achilles tendon, right? And you think about what it does moving back and forth, it kind of stretches out. And elasticity is really important. If you think back to the example of the bow and arrow, that elasticity, we want to really have, it's kind of like Goldilocks and the 3 bears. We want to have enough elasticity, but we don't want to have too much. So we kind of want to find that right in the middle. And again, that's going to be an important principle for training. Plasticity is an example of, I'll just go back to elasticity. Elasticity, think of like a rubber band that you pull on it, but it's going to go back again. Plasticity is something where it goes outside of the elasticity and it's not going to be able to go back again. So think about from an injury or something like that, where it's basically pushed beyond its natural property. And, that could be where an injury or damage, things like that. The last property is it does have the capability to remodel. I talked about the different properties in the fascia. There's some type of cell called a fibroblast, and these are basically, if you think of it, is they're little slugs that are in the body that might fibroblast slugs, and they lay down collagen to help the body remodel, whether that's after injury, whether that's if you're say a thrower and your body just remodels extra collagen and lays it down, that's going to be an important piece as well. Now, when we talk about another property of fascia, this is important for us as we move forward and when we talk about training this. So fascia responds to loading. And basically, there's two types of loading that can feed the fascia, which is chemical in the form of hormones, which is important for us ladies. And when we talk about mechanical loading, meaning the types of loading, three different types, where if you think about the tissues can be compressed, there's traction where they can be elongated. And then there's a third one, which is omnidirectional. And that's going to be really, really important for our training as well. So I have a photograph here of a haystack, and there's a story from a fitness trainer in the industry, a guy by the name of Michel Dalcourt, and he came up with a product called the Viper, VIPR. Now, the story behind why he came up for this is because he's a hockey coach, and he had these kids that every year they'd get to the finals of the hockey season, but and he would get super excited. They'd be training hard. He'd have them in the gym. They're doing their lifting, just like we showed the picture of the woman doing her squats. But every year they would get beat by this team in the Podunks that lived out on the farm. And he called them the farm team. And he could not figure it out. Like, what is this farm team doing? And somebody came up to him and said, "Hey, Michel, if you look at the puck control from the kids on the farm team, they're able to get to the puck faster. They have better control when we talk about stability." And Michel realized that his kids were just doing compressive loading and strengthening in the gym, as opposed to this is why I have the picture of the hay bale. If you think about somebody on a farm, when you go to do these activities, it's never just to one side. It's omnidirectional. You've got weight that's on heavier on one side of the body, so that's an important piece of the puzzle. And that's why he came up with this training tool called the Viper, which is to simulate what you would do on the farm and these loads in the what we call the omnidirectional movement.
And the Viper, for people who don't know, is a weighted cylinder that you kind of, can swing and do things with to move in all those directions rotationally and such, right? Like you'd be
Yep.
tossing hay over your shoulder or shoveling or that kind of thing. Yeah.
Absolutely. Yeah, it's a weighted tube, but it's funny. I just emailed a client last night and he said he loves doing yard work. I said, you don't need a Viper, just grab your shovel.
Yeah.
Honestly. I mean, it's the same thing. It's the same principle behind it.
Yeah.
All right. So why am I telling you this stuff about, loading the fascia? Why does it matter about loading the fascia? And that's because this is the key, I believe, as masters athletes to really being in charge of your movement, your athletic future. There's a picture here of the fish. I was trying to get the Finding Nemo, but this is the way I can have a picture without royalties. But just keep swimming, just keep moving. The phrase "move it or lose it." So motion or movement is the greatest healer of fascia, meaning that the best thing you can do is keep moving. And we think about our society and it's like, oh, well, I could see how that's, things are just not as conducive as they used to be. In the next slide I created here, it just says two words: an intentional movement. And this is really important. And this is what I want to share with everybody is that we're all moving, right? But time is our most valuable resource. And if we stop to think about what intention is, it's why are we doing something? So why are we doing the movements that we're doing? And this is really important to talk about. In this next slide here, I have a picture of a Ferrari engine and a beat up old rusty car. And if we think about intention, when we're in the gym, or not in the gym, we could be in the barn, wherever we're doing the activities. Why are we doing it and what is it for? So when we talk about intentional movement, and as masters athletes, one of the reasons I came up with Jumpstart Running is because the idea of we have to jumpstart our, fitness routines, jumpstart your body. We have to do things differently because what served us in our 20s as athletes is y'all are, you probably found the same thing where it's like, huh, that doesn't feel the same, or I can't do that the same way anymore. So we need to be intentional about if we're going to take the time to do this stuff, what are we working on and why? So we said, okay, strength training, right? That's to the point where it's probably like, okay, we know we need to do the strength training, but can we get more intentional about it and say, okay, we're going to work on the muscles for strength and mobility, but now, and that will help our, to give us a robust engine. But if we have this car or the framework, which is called a chassis, I learned this, that's how you pronounce it. If we don't have the right framework that's set up to hold the engine, we're in trouble. And that's, I truly believe where so many injuries can be avoided. And that's why I get so excited about this, because I think, man, if we can just help people with their chassis or their framework, they're going to feel a whole lot better, be able to perform well, and just be overall happier, which is what we want. We need more happy people in the world. But now comes the slide with this elephant on the front. We say, okay, but as we get older, what could possibly go wrong as we get older? And so now we have a list where we say, okay, well, there's normal aging. It is going to happen, physiologically. Our bodies are going to change. So then we can have poor posture, lack of. We talked about range of motion in the joints, lack of movement. Diet can creep up on us. What served us well before may not be serving us. I used to call myself a pizzatarian. I realized that that doesn't work as well. Injuries can happen. Degenerative illnesses can get into overtraining or improper training. And that's where I talked about the importance of intentionality behind what we're doing for our workouts. So I had mentioned as far as the fascial system and that there were these fibroblast slugs. There is a picture, there's a picture of a slug, but there's also a picture of somebody sitting at a desk. What happens over time physiologically is that we go through a process. It's almost called a fascial densification, where these fibroblast slugs, I talked about the fact that we have so much liquid in the fascia. With time, that starts to diminish. Not only do we have that, we can get with these prolonged postures, a desk job, those of us 50, 60, if you've been working the same job, and if it's a desk job, the body will adapt. And that's where some of these slugs have laid down the collagen, making deposits for poor posture or to stiffness or tightness in the tissues. So the picture here, we talk about youth, and I had mentioned what worked for us in our 20s. That was when things were great. There's a picture of a little boy on a slide, and he's sliding, gliding, and he's smiling because his tissues are so supple. And there's a bird that's gliding through the air, and all is well. I should have put a rainbow picture. This is like heaven on earth at this picture when our tissues, we could slide and glide. We go from slide and glide to after we turn 40, and with time, we go from slide and glide to muck and stuck. And that's what can happen with our fascia with time. It is, like I said, a physiological fact that the tissues, we have more stiffness. There's inflammation, and so that can come across as the tissues lacking, especially in that superficial layer, because we don't have as much lubrication, so they become sticky. They become fibrotic, especially in that second layer, the deeper layers of the muscle, because again, that's part of that densification process where there's fascia that goes around the muscles. And if you've got stickiness think of like a sausage casing, right? And so it's just going to wrap around there. So that's why we just feel stuck. We can get ossifications and then adhesions.
What is ossification?
Oh, thank you for asking. So it's basically like a hardening. So great question. I'm glad you asked that. If you think of a scar, like if you get a bump, something like that, and it feels hard, that's a hardening of the tissues. So that's what can happen with the fascia, and say, that's why post-surgically it's important to do a little scar tissue massage because you don't want it to harden.
Yep.
So the next slide I talked about, so these changes, so we know that physiologically that we can't avoid it. So all of a sudden our fascia is, changing. It's going through change. And then now for ladies, of course, just like everything else, there is a quote that says women suffer more from fascial dysfunction than men. There is a paper, and I put a link to it at the end here, 2019, and there is a physician, Dr. Carla Stecco from University of Padova in Italy, who wrote this paper. And it's actually super exciting because she was one of the first that was starting to look at hormones in the fascia and how it applies specifically to women. And what we're finding it again, that lack of estrogen makes a big, big deal, meaning that we have, we know that there's decreased muscle strength, there's decreased hydration, but this can result, because of this imbalance, more inflammation, more instability, which can lead to the biggest thing that I said, the most common thing I treat clients for is the diagnosis of frustration, meaning that, again, they have found that this imbalance, especially when it was super interesting when the estrogen has left the building, essentially, they started to have more of these myofascial issues that were popping up, say like a fibromyalgia, autoimmune problems. And there's something, this was super interesting, called many women have dealt with a frozen shoulder.
Yeah.
In China, they refer to this, they actually call it 50 shoulder, because around the age of 50, frozen shoulder is most commonly seen in women from ages 40 to 60. Nobody has put that together like, do we think maybe there's some estrogen changes that it's like, how about that? So that's certainly something they're going to look at down the road, even more so. So,
Oh, and they are. I mean, I've seen at the Menopause Society, they have papers now on
yep,
frozen shoulder. So the
yep.
awareness is definitely increasing.
Well, and I think back to what I was taught from a what we were taught in school, stretch it. And the amount, I'm just going to say I'm sorry to all of those patients in the past that I just cranked on their shoulders. I'm so sorry, you all. I just didn't know better. As opposed to just, now if I were to see somebody with a frozen, leave the shoulder alone, get the rest of the body moving, and we'll talk about that. Um, I wanted to, I didn't mention this in the group, into the membership group, but this is something that's really important. There's a slide here that talks about the emotional, psychological, mental, and the traumatic component of fascia, meaning there's a book out there, many of you may have heard of this, called The Body Keeps the Score. And this is where we can stress, trauma, things like that, that it will lie in the fascial system. And that has to do with, again, those proprioceptors and things like that. So knowing, I mean, this could be an entire talk in itself, about, sometimes it's not a physical issue. That's where, there's somatic workers and breath work and things like that. But just knowing that, I have the quote down here. I mentioned inflammation and autoimmune, but it's really important to know that I said it's not all in your head. And I mean that literally, that sometimes it's not all in your head. It could be trapped in your body. But I also want to make sure I bring up the fact that so many women have been told it's all in your head, and that they, this fibromyalgia and things like that. So that's the reminder that keep going to another practitioner if somebody, if you're not getting the attention that you need to talk about this system, because chances are you're absolutely right and you know your own body, as far as knowing that the problem is someplace else, and it's caused by something else. So now we get to the fun part. So we say, okay, as but again, in my case, working with runners, or what if female masters athletes? What do we need to do about this? So now that we have this information, so what do we do? Ah, this is where it gets really cool. So, ladies, I have a slide here, but the girl, I think this is really important slide. Actually, she's got her fist pumped, raised, walking into the sunset, which is kind of fitting as we're going through, 30 less than 30 days to the election. But knowing that what we must do for our bodies versus what we could do for our bodies. So I truly believe that this is no longer, maybe I should do some of this. If you think about brushing your teeth, right? For most of us, it's not optional. It just becomes something that we have to do. So I want you to think about our fascial system, that this is a must do. And so the goal of working the fascial system is tissue resiliency. And I have a picture that's put up here about pickleball. Many of you probably are big pickleball fans, but my question would be, okay, how many injuries have we heard about for pickleball, right? And I truly believe it's because most people that participate in pickleball are people that are over 40. We don't, have a proper, I hate to say proper warm up, but it's true. Our tissues aren't ready to go for that type of activity. So, what we want to work on is loading these tissues, the fascial tissues, to stimulate the natural flow and energy. If you think about just things just flowing through the body, that's what we want to work on to get our system going. So there's a gentleman, a researcher, Dr. Robert Schleich, and I have a slide here that he's quoted as saying there is no incorrect movement. And I agree with that to a point. Like I said, moving, we got to move. But when I talk about doing it intentionally, that's where I say we can really save some time and really dial in and target. Because if we're going to spend time doing this stuff, we want to make sure that we have a purpose to it. So there's 4 different areas that Dr. Schleich talked about that we can work on addressing for our fascial system. And you'll hear this, it's becoming more and more prevalent now about training the fascia. I want to train the fascia. I had Selena and I had a little discussion after last time about I had mentioned the fact that many people know the young quarterback Patrick Mahomes,
Yep.
and if you watch him and the announcers whenever they talk about him, this guy, as far as his ability to move around and the way that his fascial system is trained. Ironically, his trainer went through the Gray Institute along with a number of other places, but he's really training his athlete for the demands of the sport, which, for a sport like football, you got to be all over the place. And that's what these exercises or these categories of movements are designed to do. It's not just one thing, because again, if we talked about the function of the fascia, there's so many different aspects to it. So the first category, and we're going to go over these in detail, but the first one is to restore the pliability to the tissues. 1 second about Patrick Mahomes. So again, knowing that he is a young player in the NFL, which is very different than a master's athlete. So his training is going to be very different than what we're going to be doing. But, again, we'll talk about the importance of why these things are in there, and it is no longer optional for us as masters athletes if we want to keep doing our sports that we love so much. So the second one is going to be fascia stretching.
I don't know if we said restore pliability. I don't know if we said the first one.
Yeah, because I got distracted, of course.
Yeah.
Yep, restore pliability.
Yeah.
Second one is fascia stretching. The third one is rebound elasticity. And then the fourth one is body perception and proprioception. Now, like I said, we're going to go through all these. So when we talk about restoring my pliability, this is really important, gang, because this is when we've heard so much about, okay, so I've got all my props here. Do I need the gun? Do I need the lacrosse ball? Do I need the tennis ball? Is it scraping? Is it cupping? Is it massage? These are all things that we're doing to help facilitate motion in the tissues, right? So are these bad things? No. Are they a waste of time? No. Because again, something is always better than nothing. So we talked about the fact that there's a superficial and a deep layer to the fascial tissues. So whether you have a massage done, whether you have acupuncture, you're basically just trying to get in and move the tissues to work on restoring some of that flow. Now, what the research has found, somebody asked in the membership about the hypervolt or the vibration gun. Do I need to do that and get a massage? What it has found is that it primarily helps with flow, tissue, the blood flow, lymphatics, things like that. So that top layer. So the idea behind that, it's a good start. Think of it almost as a warm up, right? And this is why I learned this from Thomas Myers, that if I'm going to do some tissue work on one of my clients, it's never going to be all on the table because that's the superficial. Phase two is you've got to move, and that's what gets the deep layers. And we'll talk about how to do that, but knowing it's a two-part process. I really want to make sure that I emphasize that because this stuff is good to do, but we've got to move the body as a whole as well to get to those deeper layers. So that's how we're working on getting our tissues back. And then the next thing is fascia stretching. And this is where I talked about in the beginning where I had mentioned something. There's a picture of Dr. Gary Gray holding on to something we call it a stretch cage, where his hands are basically tethered to something and you're basically pulling. So think of it like if you were in your kitchen. I did this morning while my coffee's brewing. I'm grab the kitchen counter and just lean back, right? So you're just getting a lengthening. So anything that you can do to lengthen, but then once you're lengthened in one direction, go in as many different directions as possible. So if we think back to Thomas Meyer's long chain, the anatomy trains, the fascial lines, that's why just standing and doing a quad stretch versus spending time really working on lengthening through the whole body makes a big, big difference. So the middle picture here is somebody doing, almost like a yoga pose, which that's an important piece too, that yoga, as opposed to just, this is a side note, as opposed to just regular stretching, yoga is a balance between essentially the tension and the lengthening. So you're working on those two things versus just pushing on something passively. And there's the piece of the breath work as well. So yoga is a great activity to do as well. I have to say I used to be not so good about the yoga, but now that I've done it it's not only good just body wise, but the mindset piece, there's a big component of that too. And then the third picture here is me. This is an example of the Viper where I'm just using the tube where you can start. You don't have to have anything to start with as far as weights or anything like that, but progressing to loaded movement is going to be really important as well. And I have examples of all this. Celine's going to put something in the show notes. I made a document that goes over some different things that work on mobility, different things that work on all these principles. So if you're driving in the car and worried about taking notes, you don't have to worry about that because we got you. We got a document that shows you what to do with all this stuff. So that's the second piece. And then the third one is rebound elasticity. We talked about the tendons and how important it is to work on that is our, as a runner, thinking about tendons, that's basically the system that I want to work on that's going to give me speed and basically efficiency. So, yes, I've got to work on some strengthening, but as far as knowing that with time the tendons can stiffen up, I'm going to be spending some time working on the rebound elasticity. And that's where some of this jumping, we talk about how important jumping is for bone health, which is absolutely true, but how important it is for tendon health and our fascial health as well. And so there's a couple different types of jumping. You could do what's called pogo jumps, or if you think about when you're a kid and you play hopscotch, shorter jumps like that, that's going to work on foot and ankle versus power jumps, say a box jump, things like that. Those are both important to incorporate as part of your fitness routine, your fitness and fascia routine. And the last section that he talked about here is body perception and proprioception. I've said in the beginning, talked about all those sensors that are in the fascial system. And this is where we really get to work on those. And we say, man, we've got all those built in. How can we tune up our body and really take advantage of the fascial system? And this is where balancing on the boards, using an agility ladder, there's a picture of a surfer in there. That's not something I've tried yet, but it's in the pipeline. And I've actually seen, Celine, in in the Facebook group, a couple of women have talked about the fact that they've looked into, surfing as
Yeah.
an activity, which is super cool.
We have a number of surfers and new surfers in the group, and I aspire to be one as well.
Yeah, me too. Well, I think we need to maybe at the next retreat that we can have a surfing
There we
section.
go.
Um, And and if surfing is not, if we don't want to start with that, then we can simply start with standing on one foot and closing your eyes,
Yep.
because that is where you're going to really have the chance to work on your proprioception. I had mentioned this to Celine before. She had said she had done some work with stand-up paddleboard,
Yep.
you
I
know.
love it.
Yeah, and but there's a learning curve to that, right? And I don't know if I asked you, did you notice at first, like, that you were, shaky, and that with time that it had improved, or you were just so fit already?
I do a lot of balance work and I always have as a mountain
Yeah.
bike racer. So like I always did a lot of like kneeling on a stability ball while like moving a medicine ball from hand to hand and throwing a medicine ball from a kneeling position on a stability ball. So I I started from a different place, put it that
Yeah.
way. Yeah.
Yeah. And that's awesome. And I'm glad you brought that up, something, because that's one of the things we had mentioned to the group. This should be fun. Like,
Yeah.
this is where, when you're doing all of that kind of stuff, like, it's fun. And that's a really important piece. And you can really advance yourself to do some of those things that you had described. But we all have to start somewhere. All right. So one of the things I wanted to mention here is hydration. There's a giant picture of water. So we know, I had mentioned the hyaluronic acid, that we lose, we lose that fluid and it gets stickier as we. This is really important. So I took a seminar with Thomas Myers and I specifically asked the question about hydration, because that's, there's so many things out there about electrolytes and things like that. And how much water should be drinking a day. And this was such an important point that I want to make sure I mention it here. He said, you can drink all the water that you want, but if your tissues are fibrotic and glued down, it's going to go right through you. So that's why you want to make sure that, yes, because hydration is a component, but it is not the answer to how you can really work on, just the resiliency of your tissues. It's not like, if you think about a dry package of ramen noodles, and then you put water, the hot water, and then it softens them up. Maybe after you do the lengthening and the loading, that's what will take place. So that's, you want to have some hydration first thing in the morning and using electrolytes, but really, especially after do. That's why if you get a massage, they say drink lots of water. That's where that comes from, and that is important. That's when you really want to. That's the what behind the why. And the last piece that I have listed on here is that you want to give your fascia a drink several times a day. And what that means, I was listening to a seminar about this, is that we're not just handed one glass of water and say, okay, that's it for the day. They say drink 8 to 10 glasses of a 8 hour, whatever the recommendation is. Most of us are under anyway. But you want to think of your fascial system the same way. That just doing it doesn't have to be long, but these short little movements. This is where I'll take a time out. I want to really make sure that I mention this here. Talk about a movement during the day. Stand up desks, very popular, right? And I would hear that from so many clients. And yes, is it beneficial versus just sitting? Yes and no. So it's a different position, but if we're still not moving around, it's not the solution. Just,
Yeah.
it's really important. I wanted to make sure that I mentioned that to people, because if you can step away from that stand-up desk, or while you're in a seminar, really just working on some of this type of stuff, that's where it becomes beneficial. All right.
So
Next
that
thing,
giving the fascia a drink is essentially getting up and stretching it out and moving in all different planes, and then having a drink too.
there you go. Yeah,
Yeah.
it's perfect. One of the things that I'll often do is, I'm in my office, and just opening the door. And most doors, you think of, if you open it up, it's got handles on both sides, right? So that's where you can grab the handles and give yourself a nice traction, leaning
Hmm.
back, working on it like they're using the doorway. So there's lots of different ways. And again, it's just quick, 30 seconds worth. And you can swear you would almost hear your tissues say, oh, thank you. I needed that. Right. All right. So the next one we're going to do is it's funny. I shared this office with Dina Griffin, who has been on the podcast before, a wonderful nutritionist. And I think I probably scared her because I came in here one day so excited talking about fascia. And I said, have you heard about, done much about research in the fascial system? And she just kind of looked at me and she said, no, but I'm very interested. And so we've been talking about, because again, they're just starting to study this more and more. Like
Yeah.
what types of things would be beneficial. Obviously, protein for us ladies is, that's the gold standard, right? But they also talked about the fact that the sugars, it's really, that can contribute. And again, it's a giant chemistry problem as far as the breakdown of, what happens with the fascia. But just know that the sugars that we take in can increase what's already some sticky fascia as we get older. So you really want to be mindful of how much sugar intake. There's some good work from a guy by the name of Keith Barr. He does a lot of tendon research talking about vitamin C. And I put that on here because most of us, that's something that we should get from our diet anyway. But it's just interesting to see what they're, would it be advantageous to have some extra vitamin C? They're figuring that stuff out, but that came up as a prominent source. And then the last piece I put on here as far as is alcohol. And obviously this is a personal preference. This could be an entire podcast alone, but knowing your body, we'll just say that. Knowing your body, there's sugar, which we talked about, that can increase the stickiness in the fascial system. Not just for the physiological, but then also when we talk about brain health, I mean, it's just really fascinating to see I don't want to call it a movement, but the number of people that are just stepping away from alcohol because they're just recognize it's just not good for my body. I don't feel good when I have it.
What is it specifically about the fascia?
So in alcohol, you mean?
Yeah.
So the sugar
Oh,
that's
it's a
in
sugar. Okay.
and that's based and dehydration.
Yeah. 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 That makes
So
sense.
and
Yep.
like I said, the tertiary component with the brain health,
Yeah. Yeah.
knowing that's in there, it's like,
Yeah.
three strikes and I'm out, right? Now, don't get me wrong, I like a little glass of champagne. And so, ironically, this very next picture, when I went to look for a picture of feet, because I literally Googled uh, happy feet. And this picture came up with a can of beer between the feet. And I was like, well, I'm just going to leave it in there because for some people, that's all right. That works. But so I guess this is happy feet with the beer in between. But I wanted to make sure that I talked about feet. Again, it is the foundation for our bodies. When we talk about tissues, so many people will come in and see a runner's nemesis, plantar fasciitis, Achilles tendonitis. A lot of these itises are these tissues screaming for help. And what we were taught as practitioners is to, grind on that tissue or stretch the Achilles tendon, when in reality, that tendon is actually overstretched and it's a problem someplace else in the body, or maybe a lack of, we talked about stability in the foot. So that's why we really have to figure out, the practitioner needs to find out, get to be the detective and say, where is this coming from? Yes, I understand your pain is here, but that's why sometimes it can be so stubborn to take care of a situation of plantar fasciitis, because as I learned in the Gray Institute, it could be a limited motion in the thoracic spine. So that's why all of this global fascial stretching and mobility is really, really beneficial. Talking about footwear, again, that's a whole nother conversation. But the more I tell my clients, the more I'm not going to tell you to run barefoot, but I am going to tell you to do your training barefoot. So you
Mm.
can really work on that's free, again, like free money, right? A free opportunity to really work on those tissues and get that work in and, stimulate the proprioceptors. And again, this is the most important thing. Doing some work, even taking a tennis ball, stepping on the tennis ball, going through there. A lacrosse ball actually might be too rigid. So starting with the tennis ball to work, especially if you've got rigid feet, to start to soften those tissues up that much more. I know a lot of my clients now, at night, they've got all their tools. Instead of sitting on the couch, they'll sit on the floor, whether they take the 5-10 minutes to do the footwork, just stretching and things like that. Again, it's just doing something different than what you were doing before.
So
So
when
when,
you say training barefoot,
yes.
are you saying that we should be like,
Mm.
what do you mean by that? I mean, I do my weight lifting barefoot actually, but I'm not sure exactly what you meant by that.
So that's it right there. So
Okay.
when we, remember a couple of years ago when what did they call them? The monkey toe shoes?
The vibrance, yeah.
And some people still wear them. The problem was runners, God love us, runners put them on and thought that they could just start running in them. And, again, without training their feet to be able to, have the right proprioception and things like that for the ground. So when I talk about training, you said it perfectly, Celine, whether if you are in a place where it's safe, where you feel comfortable, some people don't want to go to the gym and be barefoot. Some people do it. I mean, you see it more and more now.
Yeah, or you
So
can be in your socks. I see a lot of people in the gym in their socks. I mean, obviously there's like hygienic element to not having,
exactly.
yeah.
Yeah. And so that's what I'll tell people with the least amount of shoe
Hmm.
possible.
Yeah.
And it's the same thing, it's a whole thing with running. Let the foot do what it was designed to do. And so when you're doing your activities, things like that, um, it's I'm pretty sure if you walk into a yoga studio, you're not going to see somebody in high tops
Yeah.
doing and that's the whole concept behind it.
Yep.
So
Yep.
be as natural as possible, but don't say, "Oh, Nicole told me to go out and run barefoot." That's not that's not what we're saying. So when we talk about, to wrap up, as far as the mobility and the fascial routine, first thing in the morning, you've been 8 hours. There's, the tissues are dehydrated and you want to get yourself moving. There's something in the PDF that I have that it's 2 minutes to basically go through those, what I did at the kitchen counter this morning, taking your body through three ranges of motion, three planes of motion. Knowing that the areas that we get the most stuck are foot and ankle, the hips, and the thoracic spine. So if you're going to target different areas, those are the areas that we really tend to be locked up. When it comes to doing these exercises, you want to start slow and methodical. Again, we want to clean out all the cobwebs. We don't want to miss any spots. Go through, get that full range of motion. Then you can progress to something faster. Same thing with unloaded, go without weight first, and then progress to loaded. We talked about brushing teeth, and there's something in here that says daily flossing. Floss your tissues, brush your tissues, call it what you want, but just make sure you're doing it on a regular basis, multiple times a day. That's where we talk about self-myofascial release is good to do as well.
And what
Um,
does that mean?
the self myofascial release, that's with
Hmm.
the tools,
Yeah.
like the hypervolt, the
The
foam
foam
roller.
rollers. Yep.
Yeah, so that's where we get those superficial tissues to release through myofascial techniques. Combining the fascia and the strength work twice a week. Listen, one thing that I maybe this is a question for my mother as far as following rules. um I've never subscribed to the 3 sets of 30, things like that. I look at it as, be intentional when you're doing these moves, because if you're focused on counting on the number, then you're not paying attention to the activity that you're doing. So when it comes to the thing that prompted this, when we say twice a week, yes, you want to get something formal in twice a week, every day. You want to get something going every day. And if you spend, like, I have a membership program, and my class, 20 minutes, because I can combine all these principles in 20 minutes. And I firmly believe most of us want to be out doing that. Like, you want to be out on the bike, Celine. I want to be
Yeah.
out running. So do I really need to spend an hour in the gym doing this stuff? I don't, I think the answer to that is no. And that's where the more that you do these ancillary things, it's credit in the bank. So do you need to get something formal? Yes. But, I believe that you can get some good stuff intentionally, 15, 20 minutes of a solid workout. Um, our tissues, we talked about physiology and aging, knowing that recovery and soreness, we have to pay attention to that. And I think that message has gotten out there for masters athletes that, it's not a toughness thing, it's a smart thing now. That if you want your body to, you have to take care of your body if you want it to take care of you. So really paying attention to the soreness and things like that. I also wanted to make sure I mentioned in the very beginning, because I talked about whether it's a sore muscle or if it's
Yep.
sore fibers in the fascial system, this is where using heat, because we talk about changing the temperature. And if you think about something that's gunky in there and trying to, I don't want to say melt, but again, soften, right? That's where using some heat is a really good idea. Take a bath, take a, hot tub, and then just take 2 minutes after that, reset your tissues. Oh man, it doesn't get
Yeah.
much better than that, right? And then the last thing here, we talked about hydration and diet supplements, and that's a whole nother category. That's for the nutritionists, and they're finding out more. So my
Can
advice,
we
and
mention supplements a little bit though? I mean, we can't just gloss it over.
sure,
And we talk about the importance of hydration and nutrition, of course, but like are there areas of supplementation that are emerging for this?
yeah, it's a great question, Celine. I'm glad you asked it because more to follow, right? This is something because, again, it's only been in the last, 10, 20 years that they've stopped throwing the fascia in the garbage, let alone trying to figure out and be up to date on, is there something we can take? Perfect example, collagen.
Yeah.
Is collagen, because I just said we've got 30% of the tissue where we've got collagen. But then the question is, well, if once we get older and we have more collagen with less lubrication, is it fighting itself? But
Mm.
that's where, again, it's a deep dive into the research and saying, well, there's different types of collagen, type 1, type 2. I can say this, when it comes to if you're going to supplement for the fascial system, protein versus collagen.
Mm.
They
Hmm.
haven't found anything with the supplemental collagen yet. And I did specific because I've got this stuff in my cupboard. And I'm like, am
Yeah.
I wasting my time with this? Um,
And we don't
and
know anything about creatine either.
as far as the fascia, that's a great question because we know that creatine is wonderful but as far as how does creatine in the fascial system, don't have the answer to that yet. It's a
And final, okay, go ahead. Finally, hormone therapy.
yeah. So that's again because this latest study that I've included in here um, was 2019.
Hmm.
It's crazy to think that we haven't found anything yet since, other than knowing that there's differences. So it begs the question, does hormone therapy make a difference?
Hmm.
And I haven't seen an official paper on it, but one would think, just like
Yeah.
anything else,
Yeah,
that
I
would
mean
help.
it's interesting. Like
Yeah.
because it is part of like, there was just that paper, the musculoskeletal syndrome of menopause that came out in the climactic, I believe. And fascia is certainly part of that. And if we're going to talk about like the drying of those tissues and the changing of the qualities of those tissues as hormones change, you know, as we say with everything, there's things you can do irrespective of whether or not you use menopausal hormone therapy. But it is an interesting question to ponder, how that plays into this whole process.
Right. Because, again, the fact that they're just starting to study fascia is one thing, let alone fascia and women and right?
Yeah,
Like,
yeah,
guess where we fall in the, but that's why this Carla Stecco, I heard her say in an interview, she says, I'm focusing on the women now. Like
yeah.
that's enough. And so I actually, I have since joined the Fascia Research Society, and their next meeting is actually, so it's every 2 years, and it's usually international. It's next August in New Orleans. And what's cool about these meetings, and I've looked at it, and I've looked at the history, it was, oh my God, God love the researchers, right? That are looking at the cells on the microscopes. So it's gone from researchers, and with every year, there's now more clinical, so people that are doing practical applications. So that's the long-winded way of saying your question that you asked, Celine, which is a very valid question. We can go to these conferences and are you guys studying this stuff? And so I think it starts with the research here and then trickling down to performance and training and things like that. So that
Cool.
was a
Thank you.
really, yeah, I mean, so that's why I said it's exciting. And there's nothing out there yet. Believe me, I'll let you know. That's why I said I think as far as the supplemental stuff, sticking with the protein right now is
Yep.
probably the best thing to do. Um, so my advice to women, female masters athletes, play like a kid. Take care of your fascial system and think about, what it was like when you were a kid and how much fun doing as many different activities. When we talk about the tissues, think of it like you want to squeeze out the sponge, and that's why we're doing this compression, traction, and the omnidirectional movements. Knowing that if you've got a pain, oh gosh, I hurt my hip. Well, is it in the hip or is it really someplace else? And that's where, again, first line of defense now should be, okay, I'm going to go through my movements and see if
Hmm.
I feel better. Because 9 times out of 10, you will.
That is
Uh,
a fact.
yeah,
Whenever I have a little twinge in my knees when I go through a mobility routine, it inevitably goes away. And it has nothing to do with actually the joint. It's yeah,
it's awesome. I mean,
yeah.
and that's where, again, that's why I love sharing this stuff because, and that's why I wanted to get into doing more teaching and stuff because I can only see X amount of people per day. But if we share this information, people don't have to come in here,
Yeah.
and can really manage it on their own. And it's like, oh, I wish somebody would have told me. Well, now we know, right? It's never too late to start this stuff. Never too late to start. To start. You know, I was thinking about jumping, and I have a client who uses a rebound. She's not able to jump on the ground, but she uses a rebound, 78 years old, uses a
Mm,
rebound because she's still, you know, really working on pushing her tissues.
yep.
And so, yes, she can't absorb that, but she's doing something. So she's still pumping her tissues. So you can always start somewhere. Make sure you take care. Yes, we've got that engine, but don't forget the chassis and the framework to really work on building that tissue resiliency. And I took this last quote from this was super cool. Practitioner who said, "Be an active participant versus a passive recipient." And I think for this group, for this population, these women that are badasses and want to keep doing this stuff as long as we possibly can, you don't have to tell people twice. It's just you just have to tell them how to do it. And hopefully that's what we were able to do today. So I've got a listing here of the Fascia Research Society. That's the group. Ironically, I was just listening to a webinar that they did right before we came on here today about women in pelvic health. Dr. Carla Stecco, like I said, she's from the University of Padova, and this is the article that she had from 2019. So I really hope, like I said, one of the things, like I said, selfishly, I ended up finding this stuff to figure out how I can make my running better. And now I am on a mission to help as many women as possible, 40, that really want to do these activities and the things that make us so happy. Because when you feel good from the inside out, there is no better feeling in the world. So I'm always available. I changed my business model to be hybrid so I can do consults with people. And I'm more than happy to talk about this stuff anytime because I love it. And I just think it's super fascinating. So I can't thank you enough, Celine, for having me on here, putting up with me. Uh,
No, I appreciate you. I have one um kind of a follow-up question that
sure.
I'm curious about. Um, what is the interplay of fascia and connective tissue, like tendons and ligaments? I mean, you're talking about it as enveloping muscles, and there's the superficial, and there's the deeper that your massage therapist gets with the elbows kind of thing. But where is in this whole relationship? Because the fascia is not covering the connective tissue, or is it?
Fascia is the connective tissue. So,
Oh, I understand that, but like,
right.
is it part of the Achilles tendon too? Is it part of all of that stuff as well?
Yeah, so and it's an interesting question that you have because the Fascial Research Society really had trouble when they wanted to come up with a definition of
Hmm.
fascia. They had trouble because it's encompassing, it is made up of similar properties with the Achilles, with tendons, ligaments, even blood. There's connective tissue in there, but the fascia is different because of the fasciocytes and things like that. So when it comes to say the type of fascia that covers the organs,
Hmm. Hmm.
is it more like a sheet of versus something, a sheath around a muscle. So
Hmm.
it's different properties. And so it's all globally connective tissue. But when it comes down to it, it's these different, these, it's all the system, but the different areas of the body where some of it's stringier, say between the tissues, like you were mentioning, the superficial and the deep, the properties are different than something that would be wrapped around a tendon. Or you talk about cartilage in the knee. So it's a different anatomical property. But when you look at the histological components of it, it's connective tissue, right? And same with the covering of the bones.
Mm.
So that's it as well. So I'm not sure if I answered your question with that. Um,
Yeah, you did. I mean, it is a little bit to wrap your mind around, because I
oh, pun
can,
intended. That was a good
yeah,
one.
yeah.
It's wrapped. Actually, that's part. It's wrapped in your brain as well. It's wrapped around the different layers of your brain.
Oh, it's so interesting. Yeah. Okay,
So
cool. No,
it is.
yeah,
Yeah.
that does answer my question. I appreciate that.
Yeah.
Um,
It's a
yeah,
lot.
wow. I mean, it is a lot to take in, but I think all of that kind of stuff, like whenever you have something that is, like you said, that we started this with, that they used to just like, that is so predominant in your body that we just didn't understand and it just looked like wrapping paper, so we tossed it in the trash, is um fascinating to me because it's there for a reason, my friend, right?
Yep.
Like we have it all over for a reason. It's not just,
Yeah.
we do tend to have this idea that uh we look at things just mechanically sometimes too much, I think, and just don't appreciate the all of this interconnectedness and how everything is very biologic and in
Mhm.
its properties.
And that's where you said the word, Celine. So I got to call you. It's fascinating, right?
Fascinating. Thank
Yep.
you.
So
Yes.
yeah, and I agree with you. I don't have all the answers because we don't have, the
Yeah.
researchers don't have. But when you think about the possibility for what this could mean for, masters athletes, and there's nothing out. I found very little about masters athletes because they just, like women, that's just not something. All they said is that aging tissue is stiff, but I think the things that are set to come, and that's why we go to these meetings and you go to the Menopause Society, and I just can't thank you enough that for having this, us to be able to have this discussion so we can help more people that way.
Yeah. Yeah. Well, thanks so much. And if nothing else, I think it's just a good illustration of uh the how behind the why, or like we talk about mobility all the time, right? We talk about this, but I think a lot of people again are just thinking, "Oh, I'm stretching," but there's just more to it than that. You're taking this living tissue and you're improving the properties of it so it can behave better, and perform better in what you
Yeah.
do. Yeah.
Yeah. And that's what I get super excited about the most because performing better and feeling better. And I know both of us are squirming here because we've been sitting so
Yeah.
long and, but again, now there's strategies to mitigate that. So
Yep.
instead of saying, I got to stretch, I'm like, oh, I got to think of that crazy Nicole stuff. And that's what it is. People will say, that looks weird. That's how you know you're doing it right, my friend.
Well, thank you, Nicole. I appreciate you. And good luck with your Boston Marathon training.
Thank you. I appreciate that.
Well, that's our show. Come on back next week when I sit down with Dr. Laurie Marbus, a renowned board-certified lifestyle and family medicine physician who specializes in plant-based nutrition, menopause, and of course, lifestyle medicine. And this one gets pretty impassioned as Laurie talks about how she has had to push back on some stigma against menopausal hormone therapy in an all-natural medical field. And we talk a lot about that. So come on back for that one. And until then, as always, stay feisty. You've been listening to Hit Play, Not Pause, a feisty menopause podcast for active, performance-minded women. I'm your host, Celine Yeager. The show is edited and produced by the strong, talented, and amazing women at Live Feisty Media. Follow us on social media at Feisty Menopause, And please help us spread the word. Screenshot and share this episode on your social media channels with the tag @Feisty Menopause. Share the show with your friends. And please subscribe, like, review, and rate this show wherever you get your podcasts. Word of mouth and good reviews make it easier for other listeners to find. Thanks for listening, and as always, stay feisty.